You're listening to Innovators, the podcast from Harris Search Associates, where we speak with global leaders in education, research, engineering, and the health sciences, and ask them to share lessons learned as they continue to advance the frontiers of innovation and discovery. Today's podcast will be led by Rick Skinner, Senior Consultant.
Even as the coronavirus continues to wreak havoc worldwide, the essential functions of a medical school, especially one that is a part of a comprehensive land-grant and research-intensive university, go on. At this time, no one would likely question a dean of medicine who opts to put matters on cruise control and take care of routine business. But there is scant, if any, routine business for anyone involved in healthcare at present. And then there are medical schools in which change is driven as much by deliberate decisions and actions by persons inside the schools as by events and developments outside it. Indeed, leadership is revealed best with those who pay close attention to all that is going on in healthcare, forego cruise control, and undertake major change precisely because the whitewater-like pace of events often renders the status quo an unsafe place to be. We have the good fortune today of catching up with Dr. Allison Brashear, Dean of the School of Medicine at the University of California, Davis. Dr. Brashear was appointed Dean in April 2019. Before joining UC Davis, she was chair of the Department of Neurology at Wake Forest University and an endowed professor. Previously, she was on the faculty of the School of Medicine at Indiana University, from which she had previously earned her medical degree. Her undergraduate degree is from DePaul University, and she holds the M.B.A. from Duke. Dean Brashear is somewhat akin to a whitewater rapid kayaker who knows trying to stop oneself in the kayak in which you are in on a Class 4 rapids is likely more dangerous than going with the water. The status quo in healthcare and in the preparation of healthcare professionals is not necessarily a safe place for a college of medicine these days. And COVID-19 is only one element among many that contribute to making more urgent the need for change in the preparation of physicians. Welcome to Innovators, Dean Brashear.
Thank you.
I want to ask a three-part question. In 2014, you were selected as a fellow of the Council of Deans of the Association of American Medical Colleges. And I'm curious to know what you recall about the big issues before the council then. So that's the starting point. But now I'd like to ask you, after 5-6 years now, which of these issues remain prominent for your work now at UC Davis? And then in addition to COVID-19, what other matters have gotten to the point where it's taking up time on your day? So let's go back to 2014. We were all younger and carefree, and we didn't have all these challenges. What were the big issues then?
So I think the biggest issue for deans is to help change the faculty that we recruit and bring into academic medicine. So we've done well at recruiting a diverse student population, particularly here at UC Davis. We're working on recruiting a diverse faculty. One of the things we've learned is that to really impact patients, it's important that patients have exposure to doctors who share some of their cultural background. And so focusing on bringing a diverse faculty into academics is so important. To put a finer point on it, we want our students to have role models who they can see themselves as to going into academic medicine. That's no more important with looking at the number of Black male physicians. That number has remained stagnant since the mid-70s. And so getting more Black males into medicine is a really important thing. It was important 10 years ago, and it's even more important now.
Exactly. I just interject real quickly. We've worked with Howard University now for about 7 years, and we've done quite a number of searches, including the Dean of Medicine. You're absolutely right. As you probably know, between Meharry, Howard, and Charles Drew, that's where we get most of our African-American physicians. Now, let's fast forward from 2016, 2014. Is that issue still salient or more so?
The issue with the, having a diverse faculty in academic medicine is even more important now. as we have seen with COVID and the numbers, the disparities between who's affected. Having physicians who represent a diverse workforce is critically important. We are really striving to recruit additional faculty from a diverse background. And I use that word broadly because we want to recruit faculty are first-time college graduates, faculty who are African American, Latinx. We want to make sure that our faculty represents the framework of our medical students and represents the framework of the culture of the country, the makeup of the country. That is a critical need in medicine, and we're really committed to that. The other important thing that's come up with the current pandemic is the intersectionality or the intersection of education, research, and clinical care. No more than showing that everybody in the country knows who Tony Fauci is a great example of how important research has become to our everyday lives. I never thought that the top headline in the New York Times would be about a vaccine. The ability for academic medical centers such as UC Davis School of Medicine to be really at the front lines of bringing healthcare directly to patients, research directly to patients in real time has been demonstrated in the pandemic. And it's really brought out just that sense of urgency that we have in our country to take basic science research and truly translate it to the bedside in real time. And that, I think, is one of the important lessons that we as a country should take to heart, that science matters.
Yes.
And that support of science all the time, not just in a crisis, is critically important to advancing our knowledge and improving health. That's what we're about. We're just about improving health, and we'll do that by bringing a myriad of different talents together and then improving health.
You know, I remember a statistic you cited a couple of months ago where you pointed out that in the time that COVID had come and you were having to deliver medical services, that you ramped up to 10,000 telehealth calls in an incredibly short period of time. That now is becoming pretty much the way a lot of medicine takes place. And so the fact that your faculty and presumably your students, that's got to be a boon to them because it introduces them to a technology by which they will deliver care in many cases.
You're absolutely correct. The change from in-person care to telehealth in the right circumstance will never go back. That is going to be a positive legacy of all of this terrible crisis that we're in. The ability for someone to see their doctor from their home on a phone is really a game changer. And we at UC Davis Health and the School of Medicine are really proud that our faculty were able to pivot and that we continued that pivot.
I don't know of another institution that moved that quickly in that short a period of time. It was, to me, it was one of the most impressive things that I heard that because there's always the sort of stereotypical faculty member who says, no, I can't do that. It's not done that way. That was really impressive.
If I could just interject, we have a can-do faculty here, and I'll tell you kind of what happened.
That's great.
We started a 7 a.m. Dean's Call on March 2nd, and we rallied all the researchers together and the clinicians together and the administrators together, and we said, what are we going to do about that? And we were in real time problem solving every day at 7 a.m. on how to get PPE, how to get telemedicine up and running, how to raise funds for some of our students who were struggling. And that was really a game changer in terms of engagement. Before that, we had wonderful scientists, but they hadn't really met the clinicians.
Yep.
We had wonderful basic research and clinical research, but no one really talked. And now they do that. And I'll give you a great example.
Please.
We are enrolling about 200 patients in our vaccine trial.
Wow.
And right now, that's about 30% of the enrollment are the Latinx community that we have been able to reach out to. and about 13% African American. That's the current run rate. And before all of this, I don't think we would have had the community engagement. We had 3,500 people volunteered to be screened for our 200 spots in the vaccine trial.
Let me make sure I heard that number. 3,500 people volunteered for 200 slots in an environment in which the question of the efficacy as well as the stability, if you will, of a vaccine, even then, people stepped up.
Correct. People stepped up and they did it on the internet and volunteered within about a week's time. And so it was a wonderful outpouring from the community. And it's a great example of how the community intersects with academic medicine to really be all in on trying to find a vaccine, a treatment. And so we've been really struck by the support from our community leaders in trying to get this work done.
But I also think that you have to bear some of the credit for it because you have insisted that your students be in the community. So it seems to me it was a wonderful event. That's really amazing. Let me talk a little bit about a question that's been on my mind since we talked earlier. This is September 2020, and COVID-19 remains probably the dominant feature in Americans' lives. No doubt it's something that takes up large parts of your day, every day, especially at 7 in the morning, it sounds like. Maybe we're too close to all of this to sort of draw any conclusions. But one of the things I guess I wanted to ask you about is you came there with a determination to make change. You could have put that to the side, given COVID-19. Did you?
Well, I'm pleased to tell you that our faculty and staff passed a new curriculum in May of 2020.
What?
There was a lot of work preceding that, pre-COVID, to be sure, but they came together. The students actually did surveys in the middle of the pandemic to show their support for the new curriculum, and the new curriculum passed. I don't imagine there are very many medical schools who could pass a new curriculum in the middle of a pandemic.
I don't know many universities, period, who could do that. So
we passed it, and we're working on the implementation of the new curriculum. And the thing about the new curriculum is that it really weaves in the basic science and clinical piece so that it's interwoven. And, you know, we are trying to develop medical students into physicians who are problem solvers and who see science and the clinical worlds as joined together and that each benefit each other. One of the important things in medicine that we need to do is realize that we need to develop learners who are lifelong learners. When I went to medical school, I don't even know if there was a coronavirus, but certainly it was memorization. And we want to move from just memorizing things to really integrating science into the way people think, so that our medical students graduate being lifelong learners. Because now folks like me, we're learning all about this virus and trying to understand that. And certainly virology has advanced in the 30 years since I went to school.
A tad.
It's all about lifelong learning in medicine and being a member of a team, being a leader of a team and learning science, but really being able to be open to new information, because as we have learned in the pandemic, things evolve very quickly.
It strikes me listening to you that what COVID has done is to confirm what you set out to do anyway, number one. And number two, it sort of converges with what we're now seeing becoming necessary because of COVID-19. So it strikes me that those two things that took place independent of one another really weren't that independent. They actually converged in a nice way so that the students saw the relevance of the curriculum change and the like, and you could actually see that the experiment you were undertaking in trying to devise a new way to prepare physicians, that too worked very well into what COVID is teaching us. Let me change, and I have another question that I think we've touched on parts of it. When we spoke a couple of months ago, you had a number of initiatives that you were doing, and I know the curriculum is one of them. Could you tell us again, because we were struck listening to you talk about all that you were doing at a time that we were about to get hit, if you will, by a very severe pandemic. Tell me about some of those initiatives you undertook, because in addition to the telemedicine and health medicine, in addition to the curriculum, there seemed to be a whole number of initiatives you were after.
So one of the biggest initiatives is to expand the access to our clinical trials. And we've done that. We've rapidly expanded the places and the number of patients who participate in clinical trials.
Mm-hmm.
The vaccine example is one of the highlights of the year. But we actually expanded the trials for COVID into our inpatient setting, our ICUs. We've brought a number of research trials directly to the patient's bedside, and we have partnered together with the basic scientists to develop innovative testing. We've partnered with our main campus to develop testing that is going to be available to students in terms of high throughput testing. And that really is the intersection of the health system with our main campus, with our basic researchers. It's the sweet spot that academic health systems have to bring all these people together. I'll tell you a story. On March 2nd, I called a kind of all hands on deck call, and I had our non-human primate center, I had basic researchers, the people who ran the biobank, I had the doctors taking care of the first patient who was the first community acquired patient on February 26th. And we learned in real time that we had all of these pieces that we could bring together, a biobank, a basic science, virology, and that group has continued to work with weekly town halls. We have between 100 and 200 people on a town hall every Friday. We have phone calls that really keep us moving forward in terms of clinical trials. And we've dramatically increased the amount of research in COVID. To date, since March 2nd, we have over $10 million of new research brought into UC Davis. And some of that is not in the School of Medicine. Some of that is in our veterinary school or other schools on the campus. But we've really been able to leverage UC Davis's unique portfolio across the entire campus to really improve health. And it's been just a pleasure to watch how everybody jumps in to help.
This, I'm sure you know, Dean Brashear, is a very important lesson. We've been told for so many years that you can't get the silos to come down, you can't go across the borders. Interdisciplinary and multidisciplinary may be something that the funding agencies like to talk about, it, but it's not going to happen. So you have a fair, almost to me it seems, a perfect case of where all the barriers came down, and the engagement, as that old phrase goes about the sum being greater than the whole, sounds like that's what happened in this case. Why? What made that happen?
Well, I like to think about why people work in a health system and why they come to work every day. And, you know, that's really to improve health. And some people do that by being a bedside nurse. Some people do that by cloning the most severe virus we've ever seen. Some people do that by writing another grant. But everybody has a role that they play. And I love to bring everybody's best self to work. And it is, I mean, I think the crisis of such overwhelming proportions as we record today, 200,000 Americans are dead from COVID. There is not anything more in my lifetime that has been kind of a call to everybody row in the same direction. And so it's been an absolute pleasure to see everybody at UC Davis to row in the same direction. And I think we've made substantial strides. We've brought up not only our own test in March, now we're doing high throughput testing on our main campus as the students come back to work. And we've brought significant amount of clinical trials to our community, including the vaccine trial.
I'm going to change subjects a little bit. And this is one of those questions that's probably too long, but in any event, it gets at some things that I think our listeners would like to know about. You've heard it said more times than you can recall. I know I've heard it enough, that the United States continues to spend more on healthcare than any other country in the world on a per capita as well as an aggregate basis. Yet indicators of the health and well-being of the American population are among the poorest of any developed economy. Until this year, we had 2 consecutive years when life expectancies of Americans declined. Now, the definition of neurosis, as the adage goes, do the same thing over and over and expect somehow the outcomes to change. And in the case of healthcare in America, is it our collective neurosis that A, we spend a great deal of money on healthcare, B, the indicators of health status do not change, so C, we spend more. Moreover, as you pointed out, COVID-19 revealed in a very, very stark way how inequitable healthcare and access to healthcare is in this country. And these population statistics are all the more baffling because at the same time we hear people complaining about the healthcare system, we learn of remarkable advantages. When you and I were growing up, if child in the neighborhood came down with leukemia, you knew that child was going to die in a relatively short period of time. The survival rate is much higher, and the rates of remission are very low. The fact that we can now, and I happen to know that UC Davis is doing some work on this, about developing prosthetic devices that can allow an amputee literally to feel the sensation of control over one's limb. Now, you can't by yourself or by the School of Medicine at Davis change all these national statistics. But I like to think the change efforts you and the school tried have surely rested on a notion of what can be done to alter for the better this very somewhat dismal condition we find ourselves. So for a moment, I'd like you to wax a bit on your professional sense of what is going to be required to improve Americans' health and what medical schools could do to make that improvement possible. And no, this isn't a trick question.
Well, thank you very much. I really think that we need to flip the conversation from sickness and disease to improving health. We want medical students to learn about how they partner with their patients to improve health, rather than how they learn how to take care of one disease or another. And that means developing physicians who are listeners, who lead or can be part of a team, who really bring in the family and the caregiver as part of that team. And also beginning to change how we look at solving problems. So, when I went to medical school, we learned about this disease or that disease. Mm-hmm. But really, what we want to do is to figure out how to keep people from getting disease.
Exactly.
One of the things about COVID is the folks who have a chronic disease are many, many more times at risk for getting disease. So I think the conversation needs to be about improving health, and then the conversation needs to be about how do we do that as a team. What we've learned here at UC Davis is when you get a team together and you bring everyone's best self to the table, then you can solve a problem, and boy, you can do that pretty quickly. We were able to get clinical trials up and running and within 4 days of even hearing about the trial, because we had the entire team bringing their best self to work. That's what medicine's about. That's why we have wonderful people who teach or work at the bedside or do administration and make sure that research is approved and has appropriate oversight. But all of us are bringing our best self. I think if we learn that as a country and role model that for our students, we will go a long way towards changing the conversation about healthcare from being disease-centric to being wellness-centric. Striving for improved health should be the role of an integrated medical system And we're doing that in a number of ways. We're doing that by bringing research to the bedside. We're doing that with telehealth. We're doing that by reaching out into the community and enrolling a diverse population in our trials. But the goal overall is to improve health. For me, that's what it's all about.
So 20 years from now, when you finally decide to retire as the Dean of Medicine at Davis, could you tell us what you would like your career to look back to and say, I had a hand in that and it made these 30 years worthwhile? What would it be?
Well, I certainly would want to make sure that the faculty is a diverse faculty representing our community. And I think we are on that trajectory, particularly with our diverse medical school. I also would want people who are working in health systems to be really thinking about how to improve health. And I think we're on our way to do that now because the country is aware that chronic diseases put them at high risk for other things that they never know what's coming around the corner. You know, people say there's going to be another pandemic in the future, but now we know that improving health and being healthy in your lifestyle is going to be incredibly important. So I hope that those 30 years, you say I might retire.
That was a hypothesis.
is really that we have taken this opportunity of terrible tragedy and used it to reflect on ourselves and say, how do we not end up in the same situation? And that's by bringing in lots of different people into the discussion of medicine, being a team in medicine, and then focusing on the one thing, that's the patient, and how do we keep the patient out of the doctor's office, and how do we keep them healthy as possible? And those things are really going to be the watchwords, I think, for the future.
Dr. Brashear, thank you very much for being with us on Innovators.
Thank you.
Thank you for listening to Innovators, a production of Harris Search Associates. We'll have more insightful conversations with global thought leaders to follow.